Thank you, Bob. My name is Brad Heineck. As Bob referred to me, I'm a physical therapist as well, and I'm going to talk to you about range of motion and actually performing it on the client or the resident that you'll be working with. We have Lindsay here. She's volunteering for this presentation, and we're going to start out with, I want to clarify one thing. With range of motion, one of the big reasons that Bob had mentioned was contractures, and I want to talk about the term contracture in case you're not familiar with it. What it refers to, because when I first heard it, what does that mean? And you think about something being contracted, things tighten up. Okay, if you have a contracted knee, if Lindsay's knee was contracted, instead of having full range of motion like this, say after a surgery, the knee may be limited to this range, to this range. And I get to this point, and you can no longer range it through a full extension, so it's contraction. It hits there, and it just doesn't want to go any further, or this way. You can have a contracture in any joint, you know, from the toes all the way on up. We are going to talk about range of motion to the lower extremities of the legs and the upper extremities as well as the shoulder. Okay, we're going to start with the feet. I'm going to work upwards. Okay, in supine position or laying on the back, this is something you'll do with your client in their bed, and oftentimes you'll have beds that raise up and down. Make sure you get the bed up to a comfortable level. Okay, it should be right about waistline so you save your back. Okay, now with range of motion, you'll want to stretch a little bit as well so that you're prepared for the task at hand. And we're going to start again, like I said, with the feet. Now we're not covering every little joint, but we're covering the major joints of the body. So with the ankle, a very common place of contracture is ankle dorsiflexion or lack of. In other words, they cannot pull their toes up this way. And that's very important for walking. And the way you'll want to do this is pull it up this way. This is what you do not want to do. Don't try and force the ankle with your arms like that. Do it the easy way. Take your hand, cusp it around the heel. Take your forearm right up against the toes on the bottom of the foot. Take this other hand and place it here on the top side of the ankle, and then you're going to lean with your body. You don't stretch with your arms, use your whole body, it's easier. Keep your back straight, you want to keep yourself safe as well as work with the patient. Okay? While you're doing this, you continually get feedback. Talk to the person. Okay, how does this feel, Lindsay? Is it okay?
It's okay.
Okay, if it hurts, I want you to let me know. A little stretch pain is okay, but a sharp pain like a knife digging in, then you need to let me know immediately, and I need to back off on the stretch. Okay? Now, a lot of times the people you're working with may not be able to communicate back to you verbally. So you're going to use your eyes and look at their eyes, and you can see a lot of feedback, a lot of communication with their eyes when they start to squint. You know when someone's in pain just by the look on their face. We all know that. So if that's the case, make sure you're looking at the person's face if they cannot verbally communicate with you effectively. Okay, so we're going to do this 3 to 5 times. Hold it for approximately 3 seconds. Then you're going to let off on it, let it relax. And again, 3 to 5 repetitions. Okay, once we get done with the ankle, we're going to go up to the knee. The nice thing about doing the knee and the hip in supine position, you can do it together. Okay, and you're going to bring the knee up towards the chest at the same time. Bring the heel down towards the buttock, okay? So we start here, one hand, grasp the knee joint or just above it, and the other on the ankle, and you're going to come forward. And again, talking to the patient, okay, Lindsay, how does that feel? That's okay, and we're going to come back, okay? And if you notice, I'm moving my whole body. I don't want to go like this and be hunched over because I want to protect my back as well. So use your body correctly and up and hold. That feels okay, Lindsay?
Yep.
Okay. Now let me know if it hurts. Is that enough? Mm-hmm. Okay. And back, and you do that 3 to 5 times. Okay. Then we're going to go to hip abduction. Abduction, like Bob talked about, is mean go away. I remember abduction because if you get abducted, someone pulls you away, so your arm or your leg goes away from the center or your midline. In this situation, laying on the bed, you're going to grab at the ankle, support the ankle, and support the knee. Don't just go out on the ankle. You want to have support at the joints, and you're going to go take a step back, And listen to the patient. How does that feel? No pain?
Mm-hmm.
You feel a little stretch?
Yep.
Okay, and then back in. And do that 3 to 5 times. Okay. Now, if someone does have a contracture, let's say I get up to here and Lindsay says, oh, my hip is hurting, that's painful. Don't try and push through it. Say, okay, we'll just go back to here. And you might find by the second one it'll go a little bit farther. The third one it might go a little bit farther, and that's a real successful range of motion treatment, and that's very good. Sometimes that will not happen. You'll go up to one point and it'll just stop, and she'll say, ow, and again, oh, and that's just the way it is. Okay, you want to work in that pain-free range. All right. And what I'm going to do with the arm is start at the hand and work up to the shoulder. Okay, that's a system I use. You don't have to do it that way, but you should have a system when you do range of motion so you cover everything and you are complete. Okay, I'm going to start with the fingers. Now, as a therapist, we may range each finger individually. That's not necessary in this situation. What we're looking for is range of motion with all the fingers, so you can open the fingers gently and you can get them all together. And again, the person should be comfortable with it. If anything, you should say, geez, that feels kind of nice. Then you're doing just exactly what you want. And then we're going to flex the fingers, and that's making a fist. You'll have to be careful with this. You know, if the fingers don't want to come together, that's okay. You may find one finger or two fingers are contracted already. That's common with arthritis in the fingers. Then you'll leave that finger. If this finger is stuck and does not want to come down, you can still work the other fingers and leave the tight finger there, so we still range the other fingers appropriately and effectively. Okay, and again, 3 to 5 times with the hands and fingers. Then we're going to go to the wrist. Wrist flexion, we're going to come down with the wrist. Okay? When you do this, do not combine finger making a fist with wrist flexion, because that includes tendons that work with the fingers and the wrist, and you will not get good range of motion on the wrist. So the hand placement is below the knuckle line, right here in the palm. You'll put your fingers in the palm of their hand and you'll flex down and come back. Usually the contracture, where the most tight, is coming back up this direction. So that feels good, Lindsay? Mm-hmm. No problem? Okay. 3 to 5 times again. So we went from the fingers to the wrist. Now, moving on to the wrist as far as pronation and supination. Again, supination, you can remember by palm is up, as if you're going to drink a bowl of soup. If you see it written down on the orders for pronation and supination, that's what we're referring to. Wrist up, wrist down, okay? And one hand is going to be below the wrist joint, the other one is here supporting the hand and the wrist. And this one oftentimes is works quite well. It doesn't contract a lot, but it may. And if it does contract, you just work through it gently and get feedback from the client as well. Then we're going to go down to the elbow joint, elbow flexion, hand to the shoulders, and extension, straighten the elbow out. Hand placement is critical on this one. Make sure you grab below the elbow here on the tricep and the bicep, and then here, not on the hand, but below the wrist. Okay? And we'll flex, and oftentimes this motion goes quite easy. This is the motion that usually contracts. And you may find, especially if someone has a stroke or a traumatic brain injury, when you get out here, it'll be tight. And you'll feel the muscle be tight, but if you gently hold and you'll say, does that hurt? Does that hurt? And they'll say no, but it's still tight. And if you hold some pressure on there for a second or two, it'll let loose. We call that releasing, and then all of a sudden, it'll straighten right out. While you're doing that, watch the person's face, ask them questions if it hurt. If there's no pain, that's a green light to continue on with the stretch. It's not uncommon to get a contracture to loosen up in those circumstances. Okay? So the first time it might be tight and you loosen up, and the second time it goes a little bit more. We talked about this before, and you get the full range of motion, and that's the goal. Pain-free, full range of motion goal after a few repetitions, and then you can stop. All right, moving up to the shoulder. The shoulder, we're going to do 2 planes of motion. The first one is going to be flexion, as Bob mentioned before. We're going to go up with the arm. This will be 90 degrees. This will be 120 degrees. You don't have to worry about the numbers. Just when you're in front of the person's eyes or the ears, you can stop there. There's no sense and ranging way up to here with someone, you know, in the age group we're working with. Okay, functionally we're not painting ceilings anymore. So we're gonna, at this point, I like to take this hand and support over the shoulder. The other hand is on the elbow, not up here on the wrist, but down here at the elbow. And we're gonna stretch up. How does that feel, Lindsay? That's okay. And then we go back down. And up. And back down. Now you want to watch people that have had a stroke or other neurological problems. Their whole arm might be really flaccid. And you still may have to do range of motion. And the arm will very easily come way up to here. Just because it easily goes up there and the person has no pain, I'm going to still recommend go up to the 120-degree point. Okay, that can cause problems with impingement. I'm not going to get into that. You'll just have to take my word for it that this is adequate range of motion. Okay. Now, the next range is shoulder abduction, where you bring the arm away from the body. And in this case, I like to hold and support the shoulder here, and then you're going to grab at the elbow, the same as for flexion. You can range it this direction, standing above the person's shoulder, or you can get on this side of the bed, support here and here. For this demonstration, I'm going to do it this direction, support here. The person should be relaxed. You can talk to the people sometimes if they're doing well, so they relax. Enjoy your range of motion and bring it up again just about to the ear level. We don't have to crank it way up here. That can cause impingement, the same as flexion. And we're going to keep at this point, hold it. And if it comes up to here and it feels like it's going without pain and it's still continue to stretch, no pain, Lindsay, we can go right up to that point and then come back. Your contact with a person's body can make a big difference on how they relax. So you don't want to grab on the holder and make them squint. So if you're nervous, you haven't done it before, just relax, hold the person gently. Another key point with range of motion is have the person breathe. Okay, if you see them holding their breath or they're breathing shallow, say, take a deep breath, just relax as we do this. It allows the muscles to stretch. You don't force a muscle or a joint to stretch and range out. You allow it to, and that's a mindset that you want to get your client into. The next thing, we're going to go into range of motion in a chair or seated position.